Well, every Thursday, we're taking a look at a health concern or issue affecting many people, breaking down the information for you and telling you what you need to know to keep you healthy. Dr. Kalani Brady from the John A. Burns School of Medicine joins us now with this week's topic. We're talking about the benefits and also the risks of exercise, because there are risks.
There are risks.
You need to watch out for.
Absolutely.
Okay, so first of all, when you talk about exercise, what is exercise defined as? Because some people think you got to hit the gym, you got to go for at least 30 minutes. What would you call exercise?
Generally speaking, it's bodily movement produced by skeletal muscle contraction. It's planned, it's structured, it's repetitive, and it's purposeful. So it can be many different kinds of things like heavy housework, heavy yard work, and running, and we'll get onto that in a minute.
And a lack of exercise can be bad for you.
1 in 5 adults are sedentary, and their risk of heart disease and a number of other risks increases markedly, including a 5.3 million per year risk of premature death worldwide.
Okay, and it can, like you said, increase risk factor for diabetes, even cancer.
Even cancer.
Okay.
Cardiovascular disease.
And there's a lot of benefits for exercise.
Lots of benefits. And the benefits are additive, Christine. So the more exercise you do, generally, the better your benefit for cardiovascular disease, diabetes, cancer prevention, etc.
And also it helps to lower cholesterol and also numbers. Sometimes when you're diagnosed with certain, I guess, not diseases, but certain conditions, sometimes they say exercise, and exercise can also help you maybe not even use medication.
Absolutely. And the purpose, of course, you think doctors, pills. But in fact, doctors would rather have you not take medication. They'd rather you control your health naturally with proper diet and proper exercise. And together, diet and exercise are more effective, for example, in weight loss than either individually.
Now, we always hear about exercise, how it's good for us and beneficial, but there are some risks when you exercise.
That's right. The risks are largely musculoskeletal and especially occur in aerobic exercise like running and contact sports. So they rarely have increase in mortality, but it can lay you up for quite a time if you have an injury. Also, you can have sudden death and cardiac arrest. These are pretty rare, but it's important to see your doctor before you start exercise, especially if you're middle-aged, to get a clearance for the kind of exercise that you want to do.
And what else can you do to lessen the risks before you start exercising?
See the doctor, assess the cardiac risk factors, i.e. cholesterol, high blood pressure, the lack of smoking, and sometimes your doctor may ask you to do a treadmill stress test to find out if your heart is capable of doing the kind of exercise that you want to do.
What is your golden rule into choosing how to exercise? Because, you know, some people, like you said, yard work would count as one. Maybe it's just going for a walk.
Right. Use the exercise that you like to do the best. If you don't like it, you won't do it. You'll find all kinds of excuses not to do it. But if you like it, then you can't wait, basically, for the next time.
Right.
So running, walking, bicycling, heavy yard work, contact sports, soccer, all kinds of sports, softball, baseball, and basketball are all aerobic exercise. And aerobic exercise basically is defined as continuous exercise that raises the heart rate, and you do it for at least 20 to 30 minutes. Some people do it for an hour or two at a time, but 20 to 30 minutes 4 times a week is generally sufficient.
And speaking of walking and exercising, there's an event happening this weekend.
That's right. The American Diabetes Association is holding their Tour de Cure at Kapiolani Park, and on Saturday morning at 7 a.m. they start bicycling, running, and walking, and you can choose what kind of exercise you want. It's an event to benefit American Diabetes Association.
Okay, and you'll be back next week, Thursday, right?
Yes, we're going to talk about menopause and hormone replacement therapy.
Very important. Thank you so much, Dr. Brady. Have a good weekend.
You too.